Your Excellencies, ladies and gentlemen, dear friends, I'm delighted to be part of this European high-level Ministerial Conference on the meaning of citizenship, ethics and health data. I would like to give a special thank you to the French Ministry of Solidarity and Health and of course the European Commission for inviting me to this important meeting introducing European ethical principles for digital health. You will find many of these principles also reflected in my deliberations. This is my starting point. A European approach to health data must be grounded in a new understanding of digital health citizenship and a strong set of values and ethical principles, including data solidarity. This need for a value-based and people-centered approach to governing digital transformations in health is in fact the main conclusion of the Lancet and Financial Times Commission called Governing Health Futures 2030, Growing Up in a Digital World, that I have had the privilege to co-chair for the past 2 years. And you see on this slide many of the distinguished people who participated as commissioners in this commission. At the center of our analyses is the need to redistribute power and agency for the benefit of health and well-being in the context of digital transformations in health. And you see here the title page of the Lancet Commission report, and you see the focus also we have had on children and young people illustrated by the picture on the title page. The WHO has also reinforced the need for a new global consensus on health data governance, underpinned by a core set of principles, so as to secure health data as a global public good, and to identify good data governance practices for better health, especially for vulnerable groups and communities left behind. Here, the European Union can and must take a lead for global conversations to move forward, and the ethical principles you have adopted move in that direction. The Lancet and Financial Times Commission proposes a governance model based on a set of core values: equity, data solidarity, digital stewardship and trust, accountability, and, I reinforce it again, public participation. All are based on an understanding of governance not as exclusively top-down, but as how communities invent and shape their destinies. Understanding how digital technologies reshape not only health and care services, but social relations and interactions around health can lead us to develop new forms of digital health citizenship and civil engagement for health. This is the direction Europe must take. Why do we need a value-based governance framework for digital health? We know that digital technologies and the data they generate through the technology-people interface offer great potential to improve the health of all people around the world, reduce health inequities, close gender gaps, and protect the most vulnerable. Indeed, research indicates that new forms of digital health citizenship have emerged, which include how citizens and patients contribute proactively to knowledge generation, create communities to deal with health challenges, practice data sharing, and interact with health services and providers. But governants have not yet provided the trust architecture to take this development forward safely and at scale. Despite what the technology can enable us to do, social, economic, and political forces often stand in the way of generating community benefits and also benefits at the global level. That is why we need to apply a broader view that situates digital health within a whole of society perspective and a solidarity-based digital governance framework. This means We cannot see health data as something separate from the whole digital health ecosystem and the impacts that digital transformations have on society overall. We cannot see data sharing as separate from global power relations as experienced during the pandemic. We need to factor in how citizens and patients, as the ones who generate the data, interact with technology, one another, health professionals, and the health and the broader welfare system. And we need to factor in that most of the data generated on platforms can now be considered as health data and are treated as such by the platforms. As, for example, our movement profiles became important during the pandemic. Consequently, in our Governing Health Futures 2030 report, we argue, and this slide tries to illustrate that the focus of policymakers needs to be on digital transformations in health, not digital health. The various components of the digital ecosystem must be recognized and addressed as determinants of health, either improving health or creating harm. Citizens must be able to co-design the ecosystem, and their collective input must generate collective return, not private profit. Digital determinants of health are increasingly shaping our health and well-being both directly, for example, via promoting health information or misinformation, the use of digital health and well-being tools and applications such as wearables, and the impact of body and beauty norms or of mobbing. And indirectly, through a wide range of social, economic, commercial, and environmental factors. They do this positively and negatively. While there is much focus on the need for innovation policy, policymakers need to be much more concerned about short and long-term health and social harms. And gladly, this is starting to happen. During the pandemic, of course, the political harms, the dangers to democracy have become ever clearer. The economic incentives in the digital ecosystem are extraordinary. Health is emerging as a key driver of innovation and a business frontier for major technology companies and platforms all around the world. A record of $51.3 billion has been invested in global health tech in 2021, up 280% on 2016 levels. Health is a high-stake domain for investors, and it was significantly reinforced through the pandemic. While there is great hype and excitement around digital health technologies, governments have been very slow in establishing governance frameworks as well as their regulatory response. That is why now we face the dangerous situation where the democratic and solidarity incentives are less developed than the technological development. Yet this digital ecosystem, especially during a pandemic, is grounded in its users. It only works if citizens and patients are willing to cooperate and feed it with their data, consistently share and interact with one another, and maintain it while being steered by algorithms they do not control or understand. The most challenging analyses of this extreme power imbalance of who benefits is what Shoshana Zuboff has termed surveillance capitalism. Surveillance capitalism turns the whole human experience into an unlimited resource that is converted into data and consequently into profits. This is also termed data extraction or even data colonialism. Obviously, this is contrary to the values I have outlined, and that the EU subscribes to. We therefore face a set of novel ethical and human rights challenges in an ungoverned space. Digital health ecosystems are developing without adequate consideration of the unequal distribution of power and resources that affect an individual's or a community's access to, engagement with, and ability to benefit from digital health technologies. This absence of strong ethical and human rights-based values and principles when designing, implementing, and evaluating digital health solutions risks ignoring or exacerbating existing health inequalities and other forms of discrimination, or they even create new ones. As one of the recent human rights special rapporteurs has analyzed through a critical view of the digital welfare state. He draws attention to the fact that the values underpinning and shaping the new technologies are unavoidably skewed by the fact that there is a diversity crisis in the AI sector across gender and race. Those designing AI systems in general, as well as those focused on and running the welfare state, are overwhelmingly white, male, well-off, and from the global north. This leads to an algorithmic bias which has only recently been addressed in legal frameworks such as the European Union's General Data Protection Regulation and the proposed Artificial Intelligence Act. This will be incredibly important, and we hope that through the Brussels effect, this will significantly influence the rest of the world. These gaps show us that ethical perspectives on digital transformation in health need an expansion from bioethics to socio-technical ethics that assess the broader impact of technologies on health and healthcare. Without a commitment to solidarity, justice, and new forms of digital health citizenship, health could become a favored entry point in support of new forms of surveillance capitalism, data colonialism, or digital welfare dystopias, characterized by control. Following a massive surveillance surge during the pandemic, we are already witnessing such developments in several countries around the world. The European Union must lead here. As it has stated, I quote, "The EU's approach to artificial intelligence centers on excellence and trust, aiming to boost research and industrial capacity and ensure fundamental rights. This requires value-based frameworks of ethical principles for governing health futures that put public purpose before profits and guides decision makers and other public and private stakeholders how to harness the potential of digital technologies in support of better health and well-being for all." Our Lancet and Financial Times Commission argues that any approach to shaping health futures through digital transformations should be grounded in 5 foundational values: democracy, equity, solidarity, inclusion, and human rights. They reflect a health for all approach and the universal values that are articulated in the 2030 Agenda for Sustainable Development and the high-level political declaration on universal health coverage, both of which have also been adopted by all EU member states. Recently, the UN Secretary-General called again for a better global governance of technology as part of efforts to rescue the Sustainable Development Goals. He called for an emergency response to put humanity at the center of digital transformations and close the digital divides that are actually growing. Today, it is not only the lack of access to universal health coverage, but also the lack of connectivity that kills people. Over half the world's people have no access to universal health coverage, and the same number has no access to the internet. And yet, let us be honest, it is also a lack of sharing health knowledge globally that kills, as experienced during the pandemic. That is why EU policies need to ensure digital transformations in health that create public value and actively advance social justice, rather than promoting a siloed and ungoverned adoption of new technologies and innovations as they emerge within Europe and as global responsibilities. What do we mean by a global solidarity-based approach to health data? The Lancet Commission recommends a solidarity-based approach to health data must be considered a defining feature of 21st century public health at national and global levels. Participatory data governance must be a defining feature of 21st century digital health citizenship. So we propose that a 21st century social contract in health and care in the European context must include the way we collect and use health and health-related data for the common good. Health solidarity in the 21st century is built on the notion, we think, of data solidarity. In consequence, this implies new governance models and new sets of rights and responsibilities for patients as an expression of this digital health citizenship. I'm speaking here about citizenship in its broadest sense, where all people are part of a global community with responsibilities to those both within and beyond their own societies, and those which happen to be living within the national borders of certain societies. The COVID-19 response has highlighted the risk of some approaches to data collection and management. But the use of privacy-related arguments to promote an individualized understanding of health and health-related data overemphasizes the idea of individual data ownership. It neglects the social and relational nature of all data and of health data. It also ignores the heterogeneity of data coming from different sources. So there must be a conscious effort to bring together individual health agendas, which for digital applications are more focused on aspects such as behavioral monitoring, precision medicine, disease prediction through genomic approaches, and the more structural efforts towards broader population-based impact that have long characterized public health action. The latter have been critical during the pandemic, but many countries lacked the trusted ecosystem within which to act. Research on new digital health citizenship shows the willingness of people to share information, experiences, and data. But frequently they are not aware if they are doing this on a public or a private platform, what role algorithms play in prompting their choices, and what happens with the data they share. The notion of solidarity as applied to health data and data for health goes beyond data altruism. It demands institutionalized solidarity. It can be a way of safeguarding non-extractive, trustworthy approaches to data collection, use, and sharing, building a culture of data justice and equity, and ensuring that the value of data is harnessed for global good, as indicated by the World Health Organization. So how does citizenship fit into this model? The digital ecosystem offers new spaces for public participation and civic debate, space like we've never had before, including health matters. But equitable health benefit can only be realized when citizens are able to critically engage with the ecosystems, protect themselves and others from misinformation and abuse, and make informed choices in respect to their data, such as practice data altruism or data solidarity at different levels. Civic and digital literacy are fundamental enablers of public participation and informed citizenry, which can contribute to advancing social justice and health equity. So in our Lancet and Financial Times report, we highlight the interconnection between digital literacy, health literacy, and broader democratic and civic literacy skills, arguing that none of these skills can be expressed effectively without the other in a digital age. We recommend actions to enfranchise communities and advance public participation in health and well-being, particularly among young people. A central characteristic of governance in the 21st century is inclusion. Individuals and groups must be able to actively participate in and co-create the design and implementation of digital health policy and technologies, and to feed back to decision makers, development agencies, and private companies. This includes equity frameworks for technology development and digital spaces, such as decolonial and feminist approaches, and building community resilience to be prepared for future change. It also demands frameworks that clarify rights and responsibilities. Civic technology models, which broadly refer to the co-creation and use of digital technologies to improve participation in democratic and decision-making processes, are increasingly seen as enablers of improved public policy and service delivery, including in health. The link to democracy must be obvious, and the European Union should be at the forefront of these civic tech developments, bringing together the experience in many EU countries, particularly at the local level, to support and bring alive the implementation of the values and the ethical principles. To conclude, let me recap. The massive challenges and opportunities posed by digital transformations in health constitute a powerful call for governance that is grounded in the core Health for All values: democracy, equity, solidarity, inclusion, and human rights. The development of a European approach to digital health offers the opportunity for all EU member states to put Health for All values that they have all agreed to at the center of their policies and programs to ensure that digital technologies enable health and well-being benefits for all. This is of the greatest urgency. European policies that shape digital transformations in health must be built on a participatory understanding of governance as how communities invent and shape their destiny. The value of citizens' engagement, their solidarity, and of social justice must be at the forefront of an ethical view of digital transformations in health as in other areas of society. And the principles you have adopted move us in this direction. One of the key priorities in implementing the values and ethical principles must be a strategy to build digital health citizenship in Europe and globally. I invite you all to read our Governing Health Futures report and to consider how our recommendations could be implemented in your contexts. We hope that our report is both a wake-up call and a useful roadmap to realize our common ambition for a healthier, fairer future for all in Europe and beyond. Thank you very much.